teaching people how to say the first 5 sentences to patients. So you guys may not be able to do an all in X. You may not be able to find MB2 well. You may not be able to do quadrant dentistry, but anyone can say different words out of their face. It is the easiest way to communicate with patients better, develop confidence and relationships. There's no cost to saying different words out of your face. So one of the things that I share is I think that dental school has it wrong, because when we are taught to see a new patient and walk up to them, what is the first question we're taught to ask them? What is your what?
Sure. Yeah, what brought you in, or what your chief complaint is?
Chief complaint, right? So imagine going to a party, sitting next to someone and say, what's the worst thing going on in your life right now? Okay. And before you said that, you reviewed their medical history and highlighted gout and uncontrolled diabetes. I want to share 20 years into my career, I thought I would see so much more gout and uncontrolled diabetes because they were the answer to every test question in dental school. So what I teach dentists to say, and you guys can start saying this afternoon, these are the 5 sentences I say to new patients when I see them. Everything that matters needs a system, and everything matters, including words. Hi, my name is Dr. Paul, right? Hi, my name is Dr. Paul. It's the first sentence. You can say your last name, your full name, your first name, whatever you feel comfortable with. I am lucky enough that some 85-year-olds think I'm young because I'm 48 years old. But many people think you are super young because in their world, you are super young. So if you ever get frustrated that somebody thought you were the dental assistant or the hygienist or someone cleaning up the room, did you take the time to orient their brain that you were the doctor? Because when you go to medical appointments and dental appointments as a patient, you do not know who these people running around in the same cars are. Hi, my name is Dr. Paul. I am so glad that you are here. Coming to the dentist is not everyone's favorite place to be, so be proud of yourself for coming in. I have one question for you. During this appointment, what is one thing I can do to make you happier? And then I stop talking and listen. What they share is gold. I'm embarrassed to smile at my family reunions. I'm worried that my periodontal disease is going to affect my overall health. I haven't been able to go to the dentist in the past 20 years. All of my teeth are broken. They are going to tell you their one thing that is inside of their stomach and emotions, okay? And if you can ask these 5 questions, you will bond together better with patients and people. So I'm going to turn this and ask you guys. Hi, my name is Dr. Paul. Many people know me as Dr. Nacho. I'm so glad to be here at this Lunch and Learn. Taking out the time to learn as a busy resident is not easy, so I'm proud. Be proud of yourself for doing this. Mainly proud of who was the person that put this together. Remember, what was your name?
Travis.
Joe?
Travis.
Travis. Thank Travis, because he basically did it. You guys just showed up. So Travis is your all-star here. So thanks, Travis. But I have one question. In the next 45 minutes, when we're finished, what is one thing, one piece of advice, one concern, one thing you're worried about, one thing you want to do more of that will make you happier when you leave this room? So you're all going to go around and share, and my team is going to write it down. So you're going to say your name and what is one thing you would like to get out. Anyone can start.
David, you start.
I just now I see the refrigerator. Maybe I'm supposed to see the refrigerator, but that's my main view right now.
We have like an auto camera. I don't know why. It whenever you talk, it like changes to you, whoever's speaking. So we had someone eating up their lunch.
Okay, no problem. That's classic. I didn't know about like something. Okay, perfect. So start and then pass to the next person.
If
One thing you want.
one thing that would make me happy in the next 45 minutes.
Your name first. What's your name?
Oh, my name is David. Last name Aldas.
David. Okay.
And one thing that would make me happy in the next 45 minutes is getting to learn more from you.
Well, good. But patients are going to say that, but I'm going to share with you. That's first of all, you're David Aldas, like
Yes.
#1 Nacho fan.
Yeah, I'm on Nacho quite a bit.
Yeah. So you know me better than anyone. I cannot work with, I want to learn from you. You cannot work with, I want my smile to be better. You got to dig. So I say, thank you, David. Can you be more specific about one thing not all the things, one thing you would like to learn about. And then sometimes I do help people in the dental practice with, I'm like, oh, are you concerned about bone shrinkage? Are you concerned about cavities? Are you concerned about your teeth breaking? I don't love to do that because I'm leading them, but I'll help David. Oh, are you concerned about associate contracts, buying a dental practice, getting your team on board? But I would like to know your one thing, David.
Okay. I would like to be able to have learn a couple of tips about patient handoff when I'm done with them in the chair.
Patient handoff. Okay. So my team's just say, because at the end, we're going to go through these, because if I didn't get a chance to get to it, I'll give you like a 60-second tip. Good. Next to David.
My name is Sarah
Nice.
McPhail, and something I hope I learned is what are things you would look for in a first job as a dentist?
What you look for in the first job as a dentist. And one of the things I'll share with you guys to help you communicate with patients, because you're not usually seeing 6 patients at once for this first new patient exam. So I will take a timeout and be like, here's how I create a good relationship with Sarah, who I've never met before. Say, Sarah, that is such a normal question. There are so many residents just like you that ask me those questions. A really important thing to think about when you're looking for your first job is how much mentorship will you get, how much money will you make, and what your morale will be in that office. And it's important to realize that the more mentorship that you want and will get, the less money you will make. The more money you want out of a job, often the less mentorship, because the way it works, great phrase, is that if you're an associate dentist and you want to make a lot of money, that practice assumes that you are confident and competent in most phases of dentistry. And if you really value mentorship, like many people do, you need to be open-minded to not making as much money, because what that means is that the practice owner will have to spend time walking you through certain procedures. So this is like what I love to do, work with words. But I'll ask you, Sarah, from that answer, do you feel confident I know what I'm talking about? Like, did that answer help you be like, this guy knows what he's talking about?
Yes.
So you guys need to sound that way to your patients. And I'm someone lucky enough to have been an associate, work with my dad, hire associates. Most new dentists lose the confidence of the patient in that moment because they don't sound like that when someone says, what can we do to fix my broken tooth? Oh, great question. So many patients come in here with broken tooth. There's like 2 options. One, we can do like we call it like a direct filling. Here are the pros and cons. Also, one that takes more time, called a crown, that may take more than 1 visit, but could last longer. Let me tell you about both. That's how you have to sound, Sarah. Okay, that's how all of you have to sound. Next to Sarah.
My name is Ryan Elliott. I guess what I want to learn more is patient communication. I guess learning how to articulate myself to a level where patients understand what's going on during the procedures.
So that's super common. So patient communication where they can understand what you are talking about. And lucky, I'll give you a free copy. I wrote a whole book on this that you can read. And a nice dentist messaged me on Instagram and said, hey, Paul, I was at an office and they left your book there and I was reading it, but I left it there. Can you send me a copy or can I buy a copy? Because I have a mind like a squirrel, and it was perfect because it was so easy to read and wasn't confusing. So good one, Ryan. Patient communication. Next.
My name is Travis Alkire. I guess what I'm hoping to get would be kind of some red flags in a first associate contract, things to look out for and things to be aware of.
Awesome, Travis. So if I just take this moment and role model for you, what hopefully you guys do at 2:30 with your next patient, my hope is that I teach you something that helps you at 2 p.m. and 3 p.m. and 4 p.m. Asking these questions and reflecting back to them. So you heard them, Travis, that's super normal. I get those questions all the time. And then I just give like a small dosage of an answer so you feel fulfilled. Like we may do 20 red flags this presentation, but one of the most important questions to ask when you go on a job interview, and this is one of the questions I would never leave a job interview without knowing. It would not be the first question I would ask, but I would not leave a job interview without asking this question. Now, just by me saying this, do you want to know the question, Travis?
I do.
So see how I position this with emotion? So when you talk to a patient about a root fracture, and they're like, patients, they're wild. Like, I don't know if you guys have had this experience, but they'll go, I have this bubble on my gum. It doesn't hurt. And sometimes it goes up and down. Is that normal? And I'm like, what other tooth does that party trick? Of course it's not normal, crazy patient, but they want to do anything to get out of doing dentistry. So I share with them, oh, that is a sign that there's bugs living in your bone. And if it's not taken care of, I've seen patients, these bugs, cause these huge swellings. Think of like a fire in a trash can you don't put out. It could cause your whole house to burn down. I've seen those bugs that live in the bone next to your tooth cause massive facial swellings, like the fire in a house. So see how just like I'm easily painting a picture for them. They want to know. Now back to you in the one question that you must ask in every job interview. If you do not ask this question, you will cry inside. Oh, this seems like a great practice. Like I learned about your philosophy. I see things here. I just wanted to ask this question. How often will I be the only dentist in the office? How often will I be the only dentist in the office? And I did a GPR just like you. I did a multiple year GPR, and I was amazing at surgical extractions when I was done. I'm not now. I had seen all kinds of crazy emergencies. I thought I had all these clinical skills. But when you're in the real world of private practice or corporate dentistry, and you're the only dentist in the practice, guess what, Travis? You're answering every question that day. You're in charge of everything, and you have no experience with that. So if you hear every day, I'm not joking. If you hear every day, don't take the job. Do not take it. I can tell you with enough experience that it doesn't matter if you're great at crown preps, and it doesn't matter if you're fast at fillings. If you go into an office where you are the only dentist there all the time, it doesn't matter how much money you make, your morale will be terrible. You need to have some lifeline. Now, if they say the owner's here 2 days a week seeing patients, and you're here then you're by yourself 2 days a week, and you guys have done GPR AGDs, not right out of dental school, well, maybe you would learn more. But see, in this moment, I gave you, did you find my answer, Travis, fulfilling to your question?
I did.
So think of that with patients. I didn't say, oh, we're going to get to that later in the presentation. I've satisfied this in the moment for you. Next to Travis, what's your name?
My name is Mark DeRusso. I think one thing that would be nice in the next 45 minutes would be to learn more about systems, how to implement, and how to create them.
I love this question, Mark, and I say this with authenticity. We have a quote from me hanging up in my office, and is said so many times throughout all of my companies, Del Nachos, Dentist Job Connect, is that everything that matters needs a system, and everything matters. So that is how into systems I am. Does anyone know what the most important place to have as clean as possible in a dental office is? Does anyone know what is most important?
Bathroom.
Right. David is right. The patient bathroom. Because in most offices, there is a team bathroom. I have a team bathroom. And there are scented candles. And there is moisturizer. And there is all kinds of things for the team. But no one goes and checks that patient bathroom. And this is just the reality. That patient bathroom could be used 142 times in a day. And if nobody checks that patient bathroom, it doesn't matter how cool your scanner is, people will judge you that you do not keep it clean. So Mark, that's great. Mark, since I will give you guys souvenirs and CE to take with you, but if there was one system related to clinical work outside the operatory insurance, what would be a system that you would like to learn more about?
I think the patient, sorry, you know, right now, but patient heading out of the office, transition from kind of like the handoff, I guess, transition from once the procedure is done to reappoint, payment, out the door.
So I'll share for both you and David, so I hit a home run for you. I made a post on make a lot of questions. If you really want to become a more successful person, you should read this one book. There's this one book that has changed my life. I've read a lot of books. I've listened to a lot of books. And I read books on business and leadership and culture and how not to cry inside. And this book is the best of any one that I've read. And now you want to know this book. So this is how you have to position things. It's called To Sell is Human by Daniel Pink. So To Sell is Human by Daniel Pink talks about this concept of moving people forward. We're totally in sales. We're selling help. We should be proud to sell help. My team is, if it doesn't help, it doesn't matter. Be proud to share and sell help. So a crown helps. We should be proud to share and sell this. But there's something called agitation and irritation. And people do not like irritation. They don't like it. And they run away mentally. More people like agitation, right? So if I said this to you guys, this is an agitating question, a good one. You guys did a GPR AGD. One of my Nacho interns did a GPR AGD. And after his GPR AGD, he invested $20,000 in a hands-on CE course. And he had $0. He took out a loan to do this through one of our sponsors. And he invested $20,000 in a hands-on CE course to get better at everyday dentistry and full mouth rehabs. And very few dentists do this. But what I found is that the happiest dentists have invested the most at CE early in their career, even when they have no money. So I know that even though you have debt and you want to get started with your life, a really good thing to think about is to somehow do something like this. Spend on CE until it feels uncomfortable, okay? So some of you might be sitting there thinking, I only want to do free YouTube videos. And other of you are thinking, oh, great, I want to do that $20,000 course. I don't know you. That's agitating. Irritating is all these young dentists are so interested in going on rooftops and drinking fancy cocktails and going on vacation, and you don't even value your career, Travis. Like, how could you just spend a lot of money on dental school? How could you not want to spend money on a CE course? Like, what are you, lazy? Like, do you not care about your career? Do you see how that does not make me likable, Sarah?
Yes.
And you're doing that literally to your patients all the time without knowing it. All the time. Wildly unlikable. You don't know it. You're not trying to be unlikable. So agitation, I just literally asked Mark on my group, a patient standing at the front desk with a $600 treatment plan, and they say, I need to talk to my spouse. What do you say next? Go look at this on Dental Nachos. That to me is a question that's really worthy of talking about, Mark, because my team hears that multiple times a day. I can't do this. I have to go check with I have a spouse, and I want to share with you. Sometimes I've used checking with her to not want to do it. And other times I've used checking with her because I probably shouldn't spend $6,000 without asking her, okay? But it's a question in the handoff process. So a really good office, but people got mad at me. They go, just respect it, Paul. How could you dare not respect that? I didn't say anything about not respecting it. Literally, your team is going to be standing there getting this question asked to them. And if you don't prepare them, they're going to mess it up. So if they just say, oh, go check with your spouse and get back to me, that's not good. Because then the person may never get back to you. If some people suggested, Ryan, are you down there in the center? Is that Ryan?
Yeah.
Some people suggested you say to the person, let's call your spouse on the phone now. That's worse. Okay? Like if someone said that to me, I would be really annoyed. Okay? So you need a middle answer in this handoff and say, as you guys probably know, oh man, that's a lot of patients have said that to us before. And we understand why you want to check with your spouse. Would it be helpful for me to check in with you in 3 days? And I'd be glad to be on the phone with your spouse if they need to understand the treatment. Does that sound nice, David?
Love it.
Does that sound like a good system, Mark?
Sure does.
So you need the answer to every question of the system that people ask you from how long does a crown last? Will I get permanent permanent numbness? Why doesn't my insurance cover this? I need to go ask my spouse. That's great. And last person there.
I'm Alexandra Ahern. I have a working interview tomorrow, so maybe feeling more comfortable leaving the working interview with more information about like what to leave with for sure.
Well, what's your first name?
Alexandra.
Good, Alexandra. And maybe David. So this is a perfect finale here because my blood pressure has gone up. So I want to ask you something, Alex. Do you want me to be nice or real or both?
Real.
Okay. Don't do it. Refuse to do it. Say, oh, I appreciate you asking me to do a working interview. Instead of doing this working interview, would it be cool with you if I came and observed for the day to see how your office run? I'm not comfortable. You did that already?
Yeah, so that's
Okay.
why I'm doing the.
So I want to share this with you. Still not do it. So you did the observation. Did you watch how they sterilized all the instruments step by step?
I stayed there for the whole day. Yeah.
But tell me about their sterilization process. How often do they check their autoclave for spore testing?
Well, I don't know that.
Yep, you don't know that, right? If you do this working interview and you do a class 2 on a patient and you don't like the office and the class 2 turns into a root canal, how will you follow up on that patient?
No.
Right. So this is why it's wild to me that people decide to do this. This is a practice that has patients. And how are they positioning you to see this patient? The only transparent way to do this would be to say, hey, Mark, my trusted patient, we might want to hire a dentist here. And we have Dr. Alex, and she's going to do your filling. And if we like her, we're going to keep her in the practice. And if she likes us, she might stay. But if we don't like her work or she doesn't like us, you'll never see her again. Have a good time. And also, you will have to pay full price for this. So my suggestion to you, Alex, when you're looking for a job, and I understand is, there's a massive amount of risk. Like, have you informed your malpractice you're going to be there for the day? Have you looked at the treatment plans? Are you comfortable with the work? Have you met the dental assistant? Do you know that they're spore testing? Because I want to share a scary story with you guys. It should scare all of you. I spoke to an associate dentist 2 summers ago. I will leave this person nameless. They were working for a corporate group, and they really disliked this corporate group. The corporate group never showed up at the office, ever. Like, other side of the country. He noticed that the dental assistants were not following proper infection control. Gross things, wrong things. And he reported them to OSHA and the state board. And he had his own license suspended in that state because he was 100% responsible for all the infection control. So when you are in a practice, you are 100% responsible for everything that goes on in that operatory. There's no office manager you can blame for billing, and there's no practice owner you can blame that we used an instrument that wasn't sterilized. So I'm here to help you as much as I can, Alex. I have hired multiple associates, and I've done 0 seconds of a working interview. I want to ask you, because you observed there, right? Based on your observation, do you want to work at this location?
Yeah, and it's transitioning into ownership and buying it.
So you like the office, you like the culture, right? I actually asked, why do they need you to do a working interview to hire you?
I don't know.
So I would ask them that. And what I'm doing here for Alex, even though it's probably so uncomfortable to her, is the advice you want, right? So Travis, how much are you paying me for doing this?
0.
0.
Oh, paid.
What's that?
I'm getting paid.
This is goodish, but I'm not even concerned about your pay. But I'm talking about this advice. In times in life, when you're looking for mentors, Ryan or Sarah or David or Mark or Travis or Alex, there are these magical times where you can get help from somebody where they have 0 self-interest. And you can't always do that. Sometimes you have to pay a coach. When you treatment plan a patient, you have self-interest in their crown. You want them to get a crown and you want to pay off your loans, David, right? Every single time you recommend dental treatment to somebody in private practice or DSO, you have self-interest. Today, I'm assuming you don't, because if you do more crowns there, Sarah, will you get paid more by the program?
No.
So there's no self-interest for your crown recommendations at your program. So in this moment for Alex, I have 0 self-interest in giving you this advice. It's so pure. If you go and do the working interview and somebody has a class 2 that turns into a root canal and they never told you, and someone's like looking for the records later and it was you, my life's no different. If you don't do the working interview and you get a different job, my life's no different. The best thing I can share with you is, what number of irreversible procedures do they want you to do, right? There is one type of procedure that I could see someone doing from an observation to working that would get a feel for the office and patient interaction, and it's reversible. I've never asked my associates to do it, but I could see one procedure Does anyone want to guess what that procedure is?
DOE?
What's that?
DOE, like periodic
DOE
exam?
plus what else happens there? Exam plus what?
Treatment planning.
Treatment plan plus prophies. I could see them having you do hygiene visits at a practice because it is a non-irreversible procedure. I still would not do it. But anyway, back to you, Alex, I'm here. You could text me afterwards. If any question you want to ask me about it before, during, or after, great. But what I would do is really dial in as to what do they expect you to do and how's this being positioned to the patient, right? And also, I think you could tell your classmates at some point, you should say to them, why do you want me to do this? Like, why do you want me to do it? Because I'll tell you guys, I've hired multiple dentists. I never want to put the dentist, the patient, or the assistant in that situation. When we hire a dentist, we spend weeks onboarding them, weeks observation, talking to their assistant, showing us our systems, PowerPoints, set up for success. My last associate did my own 15 occlusal composite, right? She wasn't a working interview. So I just want to share, you're going to hire people, and this is such a valuable piece of advice. I hire a dental assistant, Sarah, and I commit to their success. And if they're not a fit, I terminate them. I hire Dr. Steph. She signs on the dotted line. I commit to her success. And if for some reason she's not a fit, we separate. But I don't have anyone come and do a one-day test because that creates a lot of awkwardness and anxiety for everyone inside of that operatory. But anyway, I'll give you my cell phone number, Sarah. Keep me posted on what happens there. I would ask some of this. So let's go through some slides here. There'll be some take-home points. And if you guys noticed, I asked you, this is a good thing to say, because it's like when they do the chef shows where they're teaching you how to cook while you do it. So far, I asked you guys for your questions. Did anyone not get their question answered in at least some way right now? Is anyone sitting there thinking, I didn't learn anything about my question? I can't see you guys. Back to the fridge. But did anyone not get some answer?
No, I don't think so. I think
So
I did. Yeah. There it goes.
The magic is, guys, you're the most important person. The patient's the most important person, not my own narrative. So you asked me what you wanted to learn. I said I would get to it, and then I immediately got to a big part of it, and we might get to more. So this was the Nacho intern I was talking about, Dr. Brandon Lade, who took the $20,000 CE course. He wanted to go back to California, but he couldn't find a job that would pay more than $200,000 and do more procedures. He moved to Missouri. He's been there for 3+ years, and I interviewed him on the process of moving. So we are doing some polls. I don't know if you see it. But heading into the real world of dentistry, what's most important to you, money, morale, or mentorship? And to Brandon, it was doing more procedures and making money to pay off his loans. I want to share with you, I would have not moved across the country. Thanks for voting morale there. So you can watch his entire video on this. So many of you have dental school debt. If you're there, could you raise your hand if it's in the 6 figures? You owe someone more than 6 figures for the privilege of becoming a dentist. So what does this debt feel like to new dentists? Let's watch together. And this, Sarah and Ryan, listen up, because watch up. This is all about patient communication. So some older dentists say, what's debt feel like? Some younger dentists say, I have so much debt. So let's take a look at the second video on how we can explain what debt feels like.
Go.
Okay, this is a dentist who graduated in the 1990s with debt. Oh, it's manageable. A little tough, but manageable. All right, off 1990s debt. Next, 2000s debt in the purple. Oh, this is my generation. Not easy, but the cost to go to dental school, probably at the high end, $200,000. Okay, off 2010 debt, green sweatshirt. Oh man, dental school pricing has gotten doubled, even though new grads are making the same. Dentist income is stagnant. Okay, 2020 debt. Everybody on here.
Oh,
Next. Good. Good. Drew, can you get on?
Drew, get on the back. Get on his back.
Okay. Hold on, Drew. There's two.
So that video is 74 seconds. I've shown it to 7 people, 70 people, 700 people, and it usually gets a laugh, but more importantly, it gets insight into what debt feels like for new dentists and why does that impact older dentists with hiring associates and selling their practices. So my message to you is that if you want to do better handoffs, if you want to communicate with patients, if you want to be able to train your team, make more videos. Videos that are between 45 and 2 minutes long are a magical way to connect with people and clarify your idea. So every time I've shown this, people say, wow, I didn't know it felt that way for the 2020 grads. And I have a sense that some people at that table work out, and that was not fake. I did think I'd be able to move them a little bit in the 2020s. I thought I could get half a push-up, but I could not move them at all. So this storytelling of push-ups with weight on, push-ups I can't move this debt. It's important for you to tell stories through pictures and videos. Still pictures and videos. Of course, follow all the HIPAA rules. I have an example. We can text it to Travis, but if you text the word forms, FORMS to 215-543-6454, you will get my media consent form for patients for informational purposes. It's not the most perfect one. You are responsible for your own HIPAA rules, but it's an example of things I've used to have patients sign so that I could share their face and story. Not one time have I wanted to share a patient who didn't want to be shared. So I transparently say, I'd love to share your story to help other dentists learn, to inspire other patients. Your case turned out so well. So I don't know the rules of the AEGD program, but when you're in private practice, it could be the simplest anterior composite. If it turned out well, say patient, would you mind if I took a video of this to, share with other people, teach them, have them sign this release, because then you can use it in your portfolio. You could use it on Instagram, but I would not do it unless you get the proper HIPAA release from there. We also have a scrubs giveaway from Fabletics, our sponsor, so you're welcome to enter that. A lot of people have gotten free scrubs out there in the nacho world. I know we're all particular about our scrubs. When I was in my residency, our scrubs were shapeless cardboard, so you are lucky to have these cool scrubs. We had none of this back in the early 2000s when I was a resident. If you are looking for a job, we make free virtual business cards. This is a great way to get your face out there. Practice owners ask about them. Share what you're comfortable with. It's an easy way for you to connect with the social media world. I recently was DMing with a really nice 2026 grad, and she's like, I don't want to make one of those. I'm like, well, don't you want a job? Like, just share what you're comfortable with, because it's just a way for you to get literally connected with a bigger group. So let's go through this one for a second. I want to go to your guys' questions again for a second. This was you though, Travis, TSPS. I don't want to speed by this. On our morning huddle form, we have a treat special people special line, and we literally talk about people's birthdays, congratulating people. TSPS is a system. Travis, that is you, because you were the one who did the hard work to make this happen. So great job. You are a TSPS person there. You guys should all give Travis one of the next free things you get from one of these dental conferences or foods. He deserves it. So let's get to some of your guys' questions. I want to share all this at the end. You are welcome to text me on my own phone. Take a picture of this if you want. I talk about friends in your phone, FIPS. So you're having a bad day, you got a challenge, you can text me and say, hey, Paul, who can help me with this? You cannot celebrate or cry with someone unless you have their phone number. All of you know that if something great happened to you by the end of the day, who you would text for help. Someone not you text for help. And in the dental world, you have to teach people, you have to text people who know what being a dentist is like. So you may have an attorney friend, but if your patient refuses to open their mouth and doesn't finish the procedure, they are not going to have the context. They don't know that world. So make more dental FIPS along the way. So I want to share with you, this is Dr. Steph. It's worth it for us to talk about this. So Dr. Steph is my most recent associate, and she had worked in other places, and we did a C course, and I said, would you share about your experience working with us? It's only 60 seconds. and just listen to the words that she says.
Which means you have context to other associate experiences. What's something that you really like about working with Pennington Dental?
One of the first things I noticed when I started, and that has continued to impress me the past, 7-8 months that I've been there, is just the culture. Like right from the beginning, they, were very warm and welcoming and really wanted to help integrate me into the office. They made the get to know cards. You're handing them out to patients just to let them know more about me because I'm newer. So it's tough sometimes for patients to make that shift. But if they trust you, then they end up hopefully trusting me. And, I really enjoyed that.
I love that. And they don't teach us in dental school a lot about how to survive after dental school, but you've also shared that we're transparent with the numbers. What does that mean to you?
I think that's huge. The fact that I have a physical day sheet at the end of the day where I'm running through seeing every single procedure that's been completed, how much it was charged out for, what I made. That way I know what I'm going to have to plan with for the next month or so. That's important. But just like knowing that, ethically we're billing everything out appropriately. And you guys are also transparent with just numbers for the office. So you're not trying to hide what one doctor is making from the other. It's pretty fair overall. It's great.
Appreciate you sharing with us.
Thank you.
So I have a question. Travis, how many times did she mention how great we were at Crown Preps?
0.
How many times, Alex, did she mention finding centric relation in our office?
1.
No, centric relation to me is made up. Cool relationships are real. So this is her work in her office, and she said nothing about the dentistry and everything about how people made her feel. So when you're going to an office, a really, really important question is, I was curious. Great way to ask a question. I was curious. How will I keep track of my production? Because if I had $1 for every associate who DM'd me on Instagram or Facebook saying they don't think they were being paid right, Mark, I would have a lot of dollars. So I say things to them like, do you get your day sheet at the end of the day that you check off? I'm assuming, Ryan, would you like to commit accidental fraud? You do not want to, right? You also, David, don't want to not be paid for the work being done. The hardest part about being a general dentist is that you have to bill out like 27 codes, 23 codes, 48 codes. It's easy to miss one. It's easy to overbill. So one of the biggest tips I can give you for red flags and systems is, how track of my production? Why be able to get a day sheet every day to kind of keep my own tabs? We make our associates put them in a binder because guess who figures out their pay in my office? Who's over there? Sarah. Like when it comes time, we pay a base salary guarantee with a adjusted production percentage incentive. So the way that works, guys, is if you want to work with us, Sarah, for a full year, we're going to pay you $150,000 a year no matter what. We're also going to pay you 33% of your net adjusted production. That's 33% after lab. So let's just have fun with fractions for a second. You all passed the DAT. You can do it. So I'm going to pay Sarah $150,000 no matter what. 3 times that is $450,000. So if Sarah has adjusted production of $600,000, a third of that is 200. You take 200, you minus 150, and we give Sarah a $50,000 check. If for some reason Sarah only produces $300,000, a third of that is 100, and we've given her 150, we don't ask for any money back. Does anyone have any questions on that? It's likely one of the most important things you can take from this lecture. Any questions or further clarification, you need to understand how a base salary guarantee with an adjusted production percentage bonus work. Yes, Mark.
What do you do as an owner if you have an associate that is like underproducing their, guaranteed base salary?
So first of all, I figure out what I've done wrong because most of the time it is the owner's fault, most of the time. Are they being scheduled properly? Am I finding patients to feed into their schedule? That's most. If for some reason this associate needs 2.5 hours for a crown and an hour and a half for a night guard, we just have an authentic discussion about the efficiency needed in private practice, and it's likely not the fit for them. but we work so hard to make that not happen, it's never happened. So we've had associates that could average $4,000 a day or $2,000 a day. So my brother and I work so hard with coaching and mentoring that it would be hard for that to happen. But if it did happen, I would separate from the associate for both of our sakes. One of the things you will quickly realize, and I will share with you why we were all very self-centered. Ryan, would you like new patients in the dental practice to give you a chance on their crown? Like, would they like to give you a chance? Alex, would you like them to give you a chance? Like, you work for me. Oh, Dr. Paul can do it, or Dr. Alex can do it. Would you like people to give you a chance, Travis?
Yes.
Okay, cool. So we're all going to go to a restaurant in Philly called Elvez, and there's 2 tables, A and B, and one of the servers is Paul, who's been a server for 10 years. And the other server is Ryan, who just started. And we're going to get the same meal and the same nachos. But Paul's table is going to be done in 90 minutes. And Ryan's table is going to be done in 3 hours. Could you raise your hand if you want to sit at Ryan's table, please? Oh, but Travis, you want a chance, right?
Right.
But not now. You don't want to give her a chance, right? So this is so real, and patients know this. So if I have an associate that does a crown in 2 hours and the owners do it in 90 minutes, no problem, Alex. Nobody can tell that difference, okay? But if we have a practice owner who's used to doing 2 fillings, David, in 45 minutes, and it takes you 2.5 hours, Sarah, they will notice and say, Sarah is so nice, but I got stuff to do with my life, okay?
Yeah.
So that is, Mark, the uncomfortable conversation that, especially if you're working in a private practice with an owner-operated office, they got standards they got to meet for everybody. And it's about the quality. It's about the time it takes to get there. So that is any questions about an adjusted production? Because it's very important. So what are you going to ask? How are we going to keep track of my production? Will I get a day sheet? But guess who figures out our associates' production and how much money we should pay them? David? Who?
There's a system in place for that.
System, but who figures it out? The associate themselves.
Oh.
And then we cross-check it with the office manager so we do less work. We have like 10 providers. I got a surgical prosthodontist. You want to make a lot of money, be a surgical prosthodontist. Those people are superhero dentists. This guy who works in our office makes easy average of over $5,000 a day or more. Okay, 5,000. Like associates doing well in our office, making $1,000 a day, $1,200 a day, $1,500 a day. Great, that's great. This guy is checking his email half the time, producing 15 grand. Okay, so this surgical prosthodontist, we got to figure out his work too. We got to figure out surgical prosthodontist, multiple associates, periodontist. We tell people, help us, tell us what happened. This is the stuff they should tell you more about when you go. So here's the thing. Back to being confident. I gave that confident answer of morale, money, and mentorship. So maybe it's you tomorrow, Alex, or maybe it's you, Ryan, on an interview. When you look across the table and just go, oh, hey, like, how do we figure out my production? Like, will I get a day sheet every day? Will we reconcile quarterly? You will know in under 3 seconds if they're confident in the answer. And if they are not confident in how you get paid, it's enough to really not want to take that job. Because here's the thing. All of you are going to likely be paid on, watch this. I have an associate dentist. And let's say she came tomorrow and she left the office because she's moving to California and she gives me no notice, Sarah. But I owe her $10,000 in her production from percentage. If I don't want to pay her, Travis, how's she going to get it?
That's a good question.
The answer is it's sometimes impossible to get. Not just help once. One time, this guy was owed $30,000. He made an anonymous post. I'm so proud of this. He goes, I left an office. They owe me 30 grand. Okay. And I go post this on the group anonymously and see what people say. And the answer is you can report people to the Department of Labor for not being paid, but you need a contract and you need an agreement. You can't just say, oh, they said this. And the guy showed his old boss the, and he cut him a check for $10K. So he didn't get the 30, but he got the 10. Without nachos, Ryan, I think he would have got 0. So I want to share you don't want to get too far behind in what you're paid. So in that example, Mark and Alex, I use that example of like 150 and 200, but the reality is we kind of settle up quarterly. Like, I don't want to owe you, Travis, 75 grand at the end of the year. And you don't want to have an office because if you leave, you're not getting it most of the time. I tried when one of my associates went on to Perio, great specialty, and we tracked her production for a full year and sent her little checks, $200, $280, right? Whatever little insurance payments came in from them. But like, it wasn't meaningful. It wasn't that meaningful. We did it just to be good. But after a year, we really couldn't keep track of it anymore. So the message is, don't let anyone get too far ahead, or don't let yourself get too far behind payments. All right, Haley, what did I do wrong? I want to bring the presentation back up. Share screen. Here we are. Good. All right, a few more slides and a few more questions. Let's do the speed round with your questions. Which one are there? Right after this, go. We talked about biggest concerns going into the real world of dentistry. That's good. Finding an associate position in your area. Okay, so whoever asked this question, it's a common one. So here's a good example. Are you looking for a job, Mark, in general?
Yes.
Okay, good. Here we go. Perfect. Mark, would you like a full-time job 4 days a week where you can make $300,000 a year in a fairly supportive environment using your GPR and AEGD skills? Would you like that job?
That's great.
It's in New Mexico. Do you want that job?
No.
Oh my gosh, Mark, I thought you just wanted to make money, right? So this is the whole answer. If you need to be in a certain area, your part-time job is to find a job. Parth Patel, one of my mentees who now owns a practice, went on something like 27 interviews, applied to like 62 jobs, and he found an amazing job with the Philadelphia Eagles team dentist placing implants. But many of you spend more time planning a bachelorette or bachelor party than finding a job. I don't know why. So you should be, you're laughed because it's true. I've seen complicated Google spreadsheets about going to Las Vegas and which club we're going to go to in the day and the night, right? Real work. And then I see, oh, are you finding out? Oh, I hope someone gives me one, or my mentor might find one for me. You guys are the ones with the proverbial financial feet to the fire. Obsessively apply to Job Connect, Indeed, school websites, go to CE. Previous doctor I worked for was a super GP, did everything, and patient loved them for him. I'm not certain how I can financially make it in dentistry without being a super GP. So a couple of things about super GPs. They do exist. They most often exist in areas where there's not a lot of dentists and patients need them to do more. If you practice in a city or suburbs, specialists are a bigger part of your treatment planning. So most of the time, super GPs are in ruralist locations, most, not all. Secondly, I wanted to be a super GP. I did a 3-year general practice residency. I did implants and crown lengthening and endo, and I found it was exhausting to think about that many things each day. So you do not need to be a super GP. What you do need to do is get really good at basic dentistry, crowns, class 2 composites, restoring implants, making night guards, regular stuff, like really good and efficient, and then start adding one skill at a time. So if you have $10,000 to spend on C, Alex, I would do it all on one thing, like extraction bone grafts. Not $2,000 on clear aligners, not $2,000 on cosmetic dentistry, not $2,000 on sleep apnea, because knowing a little bit about multiple specialty procedures is useless as a new dentist. Going to an office and saying, I feel confident extracting teeth, preserving the bone, and placing some implants is very, very valuable. But you do not need to be a super GP to be successful. So speed, guys, is mostly mental, not with your hands. Aaron Nicholas will send you Dr. Aaron Nicholas has helped my associates. He's an efficiency expert, one of our Nacho sponsors, and he does time studies, and he asks you to videotape yourself. One person videotaping himself said they were slow, spent 12 minutes clicking around on the computer, never talking to the patients. So you need a system. Patient seated, what you say, funny joke, let's get started with my assistant. So speed comes from systems inside of the operatories, communication, clinical, and mental. Not having a mentor to figure out challenging cases or being slow with procedures. That's a real concern. And my suggestion is Go to as much local CE where you work as possible. Kois is one of my idols. I idolize that guy. Don't go to Kois. Don't go there. Maybe when you go to Kois. Maybe when you control your own destiny, go to Kois. Go to the CE in your area, sit next to older dentists, and ask them questions. That is the unlock to finding a mentor. Difficult assistance is such a challenge. The thing is, you need to train them to work well with you. Some of it comes with kindness. Some of it comes with systems. Some of it comes with being firm. The dental assistant is not in charge of the operatory, but they're part of the operatory. You can text me offline if this was a specific thing that you had a question about, or you can text me on my phone if you did. This is like a chronic challenge for your entire career. But writing out your procedures, developing checklists are all ways to make that possible. So this is my free book. I'm going to unshare, take a picture of it. If you text book to this number, you can read this and you can use it yourself. And my team will send you a free copy. Morgan will also send this link to the Travis text thread. Hope you guys all text me by now. Text me your name, what you want to do after your program, when you graduate from dental school will become FIPS. And then if you do not have disability insurance right now, get it as soon as possible. There's a new dentist who is literally unable to pay their rent because they did not get disability at this time in their career. They became disabled. I message with her frequently, and they did not get disability insurance when it mattered. They became disabled, will not practice dentistry, and have a financial catastrophe on their hands. Share before I unshare for the last 5 minutes is, and Morgan will share this too, if you do not pay an attorney to review your contract, it's hard for me to say this, Travis. I don't know. David, sometimes if you heard people say, oh, look, it's Dr. Nacho. He babies new dentist and he's too nice to new dentist. And oh, he's an enabler. So watch, I'll give you a dose of kind annoyance. If you have a problem with your associate job and you signed a contract without paying an attorney to review it, I have little to no sympathy for you because you chose to put yourself in that situation. Whether lack of awareness or being too cheap. And this is the time, guys, where I will now use my kind annoyance. Some new dentists, some residents say, I have no money, Paul, to hire an attorney like Kristen Wake from Bridesmaids. Help me, I'm poor. But then I look on Instagram, Travis, and you're in Mexico. And I'm like, they're giving out free trips to Mexico? I can't believe it. This was Travis. He said he had no money. And I'm not joking. 5- and 6-figure mistakes are made by you by not doing this. So ask your parents, get a credit card, save the money. Someone who had no money sold his articulator. No family money, no nothing, to have an attorney review your contract. The reason why is not because they're going to negotiate for you, David, like it's a TV show. It's because they're going to make you very aware, Sarah, of what you are signing. And as an example, if my associate wanted to work in Pennington, New Jersey, if she wanted to buy a practice in Pennington, New Jersey, she should never have worked for me. Because we have like a 3-mile restrictive covenant, David. It's very reasonable. But if she leaves, she cannot be within 3 miles of our practice for like 2 years. So if there's a practice for sale down the street, Sarah, and this was her dream to work in this town, she should have never taken an associate job with us. So the attorney is not there to argue, to make you aware of the red flags they see in there. And you cannot read it as a dentist. You cannot read it with their language. And I cannot express to you more how many cry inside and outside problems happen from residents not being aware or being too cheap. So good news, Travis, you're aware and you won't be too cheap. You know an attorney and you won't be too cheap. So in the last 5 minutes, this was super fun. Does anyone have any last second questions they'd like to ask?
What kind of procedures is your surgical pros guy doing?
I mean, their main thing is evaluating teeth that are questionable to be maintained long-term. I don't say saved. And either maintaining them with root canals and crowns. He doesn't do root canals. We have an endodontist. Or removing them for implants. A lot of implants on people ages 60 plus some all on X, not all on X, but mainly implant extraction, bone preservation, implant driven is the majority.
Like more so single tooth implant replacement or overdentures, hybrids?
More of the second part there. He does the single tooth, but he did a Yukon surgical pros, which had a tremendous amount of pros training. So he just can come in and consume as much dentistry as he wants to. Very talented guy. And now listen, he's not doing zygomatic implants. He doesn't even do lateral window sinus lifts, right? Doesn't mean he just does a lot of like 1 implant, 3 implants, all on X, overdentures. And he's also this like, they're just such wise treatment planners because they've seen it all. So they can just direct it. So, sometimes he's maintaining teeth with multiple crowns, sometimes doing combination cases. It's pretty cool. It's a lot of pressure though. I'm not joking. Like it's not all about money. There's a lot of pressure on that type of dentistry. His name's Dr. Rob Slough. We have a whole course with him. Morgan, give him the Super Dentist Boost recordings from last year. He spoke at Super Dentist Boost about all on X cases and planning them. He's just an amazing guy. He's like 38 or 40. We're lucky to have him. Any other questions? What did you take away from this, Sarah, that you're going to do different in the next 3 days?
I probably need to turn my job search into my part-time job.
Yeah. How many have you applied to so far?
Not many.
Not many is a cover up for probably 0. Okay.
Pretty much.
But I say this because I care about you guys, right? I'm going to, in 2 minutes, go back to my life. Do you need a job to pay your rent?
Yes.
So get one. Like, I don't understand. I have these brilliant dental students and residents who have done everything right. And I'm like, how are you going to pay their rent? And you think some magic job fair is just going to come and give you a perfect one. And also, we're working this. You got to get credentialed sometime with insurance. You got to sign up with the state. You got to pass tests. It's like very complicated to get started work at a practice. I'm not joking. If you met someone today that you loved, Dr. Sarah, that you thought was an awesome person, like starting to work there 6 months from now would be very fast when it comes to state licensing, insurance, and credentialing. So text me. I'm here to help you. Travis, great job. Where are you guys located? Oklahoma?
It is the famous Delta Dental sign.
Oh, yes. Yeah. How do people allow that? I don't know. Like maybe like freaking Doritos should sponsor like my daughter's preschool, right? If they pay enough, right? Like, so yes. Awesome, guys. I hope to see you guys in person. I go to different events, stuff in Philly. Stay connected with us. I know it's a lot to listen to me for an hour, but hopefully you got some, laughed a little, learned a little bit, felt less alone from it.
No, we really appreciate it. Thank you for
much.
taking the time to do this for us.
Oh, my pleasure. Please text me with anything you want. Travis, you're Phipps. You guys all be Phipps. Something's going to happen where you're glad to have my number and be like, is this normal? And I'll text back like, this is wildly not normal. Please do not do this next thing. So thanks, guys.